so far is nearly 643,000. Well, yesterday, the President expressed concern about the possibility of a third wave of COVID-19 infections in the country, saying he is seeking ways of dealing with that. The latest report from the Department of Health shows that the number of new cases has breached the 4,000 mark now. This is for the first time since the beginning of February. Let's discuss. We're joined via Zoom by HEALTH CEO and medical expert, Professor Ramneek Ahluwalia. Professor, thank you for being with us. Firstly, I remember the last time the President spoke, I think we were at about 1,200 cases per day. Then we went above 2,000. There was a bit of a jump. Now, in a short space of time, perhaps, we're above 4,000. How significant would you say the increases are that we're seeing?
Quite significant, Francis, and thank you for having me. Francis, no doubt, 4,000 cases and the way the cases are increasing. We've seen a 46% increase in just a matter of time. and as much as we are at the brink of classifying it into a third wave, we are yet not into a third wave as per the definition of classifying into a third wave. But I think...
Well, what is the definition? When do we hit third wave status?
So when we say third wave is when you look at the last peak of the second wave, which was about 18,000 cases a day that we were recording, and should we see a 30% of that number, which is around 4,000 that we started seeing, but for 7 days consecutively, then we start classifying ourselves into entering into a third wave. So the question is, this number that's come out in South Africa, which is reality, is making us feel and making us understand that we are at the brink of entering a third wave.
Yeah.
You must also remember that the people who are being reported as being positive at this moment in one day might not be the correct figure, because there are many more South Africans who might have asymptomatic or mildly symptomatic and not testing. These are people who are testing and we know the results as positive and being classified and labeled as a day rate of 4,000. So definitely, I think it's a situation of huge concern. There are many reasons for why we should consider why we entering into a third wave. And these reasons are quite obvious to us. One is we're seeing a huge relaxation in behavior. We are seeing people congregating together. The whole notion of the entire behavior change that is warranted in this epidemic is being relaxed at this moment. The second big one is the infections. The second wave that just happened built a natural immunity among South Africans. But there was also a natural immunity that was built in the first wave. Now, the reality is science is clearly still not able to define how long does our natural immunity still sustain from escaping the reinfections. And there's a high possibility that the virus might be reinfecting some South Africans who probably had infection in the past and are likely to get reinfected because the natural immunity is weaning away.
And the new variants, the different variants make that more likely, right?
Exactly, Francis. So the third reason is the variants. Now, there are, we know in South Africa that we had a variant detected in South Africa called the 501V2. We have a variant detected in UK. Now we have a double mutant, which we know is very popular, B1617 from India. And like this, there are many mutants. We are aware of those mutants even in South Africa. But the question is, if there is a new mutant that we're still finding or genetic sequencing, which escapes the natural immunity, which escapes the immunity produced during the first and second waves, then the third wave becomes much more lethal and our understanding of the wave becomes quite obvious. So the aim is to watch these variants very quickly. If the variants are the same variants that are still in South Africa and are still spreading because of behavior change, then it's fine, because there will be natural immunity that will prevent South Africans from getting reinfections or being supported in fighting this infection of the same variant. But if there is a new variant that escapes or becomes highly transmissible, like we've seen quickly from the Indian epidemic right now, the Indian pandemic at this moment, clearly defines that we need to be extremely vigilant. And this 4,000 will define. And the last point, Francis, is the seasonal. Now, as much as this virus is non-seasonal, India is in summers and seen a huge pandemic in India. But viruses in general love winters. And there is no way, there's always a reason that COVID will prefer the winter season. People are living in closed rooms, windows are closed, and that settings will make the virus spread from one individual to the other. Exactly that's what the virus wants.
You say we're on the brink of a third wave. I mean, what do you expect here? Will it be a matter of days or weeks before an official third wave is declared? According to that definition, you said 30% of the peak cases that we saw in the second wave.
If there's one message that has to go from this interview is that if people do not change their behavior, if people do not take COVID the way it caused us a massive burden during the second wave, people do not remember that, we definitely will enter from here into a third wave. And there's no doubt about it with the rise of infection we are seeing. We need to also watch out the new variant and how aggressive the new variant will be. Should there be a new variant? If the already existing variants are the reasons of our infection increase, we do not anticipate a third wave going to be more lethal. It's going to be more calmer compared to what we've seen in the first or the second wave in general. But if there is a new mutant, which is obviously the reason why, because viruses keep on mutating, then we need to have a huge concern at this moment. So it will take a month to maximum 2 months for us to reach the peak of any wave. And if this is the start, we should start counting the number of days should we as South Africans are not ready to change our behavior. And behavior change is very, very sensitive and critical at this difficult time.
Professor, I agree with you, but it has been confusing for some people, and I don't know if you can comment, but politicians, for example, who are not health experts, the Gauteng Premier said a while back that the province was already in a third wave. So was he using that official categorization, or are some people being too quick to sort of say we're in a third wave, which adds to the fatigue, perhaps?
I think it's a very, when you have a pandemic of this kind, which is absolutely new and it's new to human mankind, be 1 year old, we're learning from the global data. I think there are many perceptions of alerts that needs to be raised. I think there are lots of scientists that are working in the provincial data perspective to the national and global data perspective. What I am explaining is the definition of how you classify a third wave. It's highly likely we are already in the third wave, on the brink of entering into a third wave. Yeah. So looking at the numbers of 4,000, looking at the data from Gauteng, I really think that it's very advisable for people to take it extremely seriously. We need to presume ourselves into third wave if we are not officially into scientific definition of a third wave so far. But the reality is the number increase is absolutely indicating towards where we're entering as a country and what we see from other parts of the globe data, and specifically India at this moment.
And you're saying people shouldn't let their guard down, that is contributing, wearing masks, all of that, social distancing. But what about policy interventions? Any comment? Because as we know, South Africa suffered tremendously because of closing schools. Kids haven't had access to nutrition. The economy battered by the lockdown. Would you say this time we need to handle things smarter, or are you absolutely fine with knee-jerk reactions, closing things down because of the health risks?
I think now, when we were in last year, probably during the lockdown 5 and the president declared us in lockdown 5, we had very little information on this virus. There was an understanding this virus spreads through droplets, there was surface spreading, and there were many other understanding the scientists were trying to tell us. A year from now, we actually know a lot about this virus, how it spreads. So we have an economy, we have education, we have health systems, we have foreign trade, we have bilaterals happening, collaborations happening. The world needs to move, and we need to now believe to live. No, the reality is we need to learn to live with this virus. This virus is by now not anymore an epidemic or a pandemic, it's endemic. And when I say endemic means humans need to learn with this new virus, who is bound to stay with us for much, much longer than we anticipate. And when we have to learn to live with this virus, we need to start understanding how this virus spreads so that those policy restrictions, those understandings that make us vulnerable to the virus needs to be put in place versus all the other things that can still continue while the virus remains around us.
Yeah.
We cannot stop education, we cannot stop trade, we cannot stop business. But what we can do is we can make it conducive in a congregate settings where we know the virus spreads in a way that we can limit the spread of the virus. And that's exactly what humans need to do. Wearing a mask, making sure that there is enough ventilation in the room, ensuring that there is spatial distance between individuals, not shaking hands, not going into the kind of collaborative ways of we used to live has to change. This is the reality, and everyone in the world needs to understand the reality of the new world we are living in. And so I think restrictions are critical. There is no other way. If we do not follow our behavior change and we enter into this third wave, which we are almost at the brink, there is no choice for a president to go and impose restrictions like a lockdown 3, 4, or a 5, depending on the level of our virus spreading into our one human to the other, because our systems will collapse. Exactly what we've seen in India at this stage, or what we saw in our second wave. And we can prevent that should we be able to control the same spread, because all this virus wants us to move from one human to the other, because that's exactly its way of survival. And we need to stop its way of survival by making it spread from one individual to the other.
Professor, the scenes that have been recorded in India, the information coming out has been horrific. Do you fear that South Africa could face something as awful as that, or not, given what happened in the first and second wave? We had some crowded hospitals, but generally it seemed like we coped. There weren't bodies on the streets like people have seen in India.
It's a brilliant question, Francis. I must say that. I tell you why. Should there be a new variant, and virus will mutate, and if the variant is highly transmissible and comes to start escaping the natural immunity, or the immunity that was developed in the past is not able to survive the immunity, the virus can then lead to many South Africans very quickly become positive. I'm not saying that's the case right now. It's something that can happen, and what you've seen in India, exactly how India got caught. And purely because they did not follow any restrictions. There were political rallies and many reasons coming from India where people had actually lost everything from the behavior, thought they had the first wave, they had the immunity, and the virus is over, which was purely what the virus took them for a surprise.
Yeah.
But in South Africa, because we've just gone through a second wave, we had a natural immunity built because many South Africans became positive. We know the ones that became positive to the ones who tested. But there are many more who do not test and were positive and still developed the immunity. And now with vaccines coming in, vaccine immunity will always be far stronger than the natural immunity. And should South Africa be able to vaccinate and people be able to control their behavior, and we can limit the third wave and the mutant spreading or the development of the mutant, our third wave will be far less lethal compared to even our second wave, and forget India.
Yeah.
But should we have a mutant which is highly transmissible, which escapes the natural immunity, causes reinfection, overburdens our health system, and we still do not impose our behavior, I must compliment government for this one, that our president has put restrictions at the very timely spaces where it has not led our country to experience what India has experienced. And I think that's the right way. You have to put restrictions, you have to put severe lockdowns, because we do not want to end up in a situation. And lastly, what we need to now realize is in India now, the virus has moved from urban centers into rural. And I think that's what in South Africa we need to be capable, because in all our developing countries, our rural infrastructure will be far less equipped compared to the urban infrastructure. And that is what we will do it via restrictions to make sure the virus slightly not moves as aggressively as it was in India at this moment.
Sure, and we're already reporting concerns about reaching rural residents in the Eastern Cape. Thank you very much, Professor, for that update. Hopefully the better scenario plays out, the vaccine rollout speeds up, but he does say we are on the brink if we're not even in the third wave yet. That was Professor Ramneek Ahluwalia.